So I'd like to introduce our speaker today, Corri Planck, and she's the Strategic Initiatives Manager for West Hollywood, who will tell us about their AARP Age-Friendly Program that started in 2016. And she'll talk about the startup, the positives and challenges. And so, okay, Corri, we're
perfect.
Ready for you.
Thank you so much. And thanks for reaching out and inviting me to your conversation today. I just have a few slides and my conversation with Harriet, really just kind of talk through what our program is, and then happy to answer any questions you have or share information that is helpful to your process. As Harriet mentioned, in 2016, the city finalized a strategic plan that was called Aging in Place, Aging in Community for West Hollywood. And we did that with a significant working group internally of staff from various departments and divisions, everything from public safety to communications, to planning, to rent stabilization and social services. So lots of different economic development, lots of different folks that were in the mix. And then we did a lot of community engagement with our older adult population, but with the city population generally. Everyone is aging. And so we wanted to make sure that we could have a really kind of robust community engagement process to create this plan. And so then I'm going to go to the next slide. And hoping you can see this. The West Hollywood plan is connected with AARP, as we talked about with Harriet, but also with the World Health Organization domains of livability. And then we were also one of the first cities, I think we were the first city to sign on to the Women's Alzheimer's Movement's 5-step plan for making a more Alzheimer's and dementia-friendly city. And so we work with those 3 organizations to kind of help shape what the domains of our strategic plan would be. And I think as you're looking at going through the criteria and the process with AARP to become an official city in the network of age-friendly communities and livable communities. And so we did that. So the World Health Organization has their domains of livability, as does AARP. And when we started, we used the initial 8 domains of livability that those 2 organizations had outlined. And over the kind of course of working through our strategic plan, what we realized is that there was flexibility in the network and in our program to add domains that made more sense for our community, that addressed some of the issues that were coming up. And so we added a domain for public safety and emergency preparedness right before we added that, a few months before the COVID pandemic hit. So we got to kind of test that out pretty quickly. And then in partnership with our Women's Alzheimer's Movement and with some of our contracted social service agencies, we also were really seeing need to add more programs and awareness and services for people who were impacted by Alzheimer's and other dementias, and whether that was the person themselves who was impacted or their caregivers. So we added those domains, as we've learned through our connectivity with AARP and participating in their regional roundtables, that there is flexibility in how you use or add domains, or even if a domain doesn't work for your community, that you could drop that and maybe add things that would work better. And one of the things I think Harriet had specifically asked was, how did we do that work? How did we, get the community feedback for the strategic plan and for the AARP criteria? And so we did a lot of community engagement, as I mentioned before, and then we do ongoing evaluation of our strategic plan. So every year we do an evaluation of how are we doing in implementing all the things in the strategic plan. And we did hire a consultant firm to help with that part of the work, so that there would be a kind of a a non-biased, not a city staff person evaluating our own program. And so we asked for outside consultant to do that. And they did surveys with the older adult population and the service agencies. They also did some things very simple, like not simple, but looked at how much of the public meeting content was talking about aging. So they looked at keyword surveys of all the city advisory boards and commissions and city council meetings to see how often were older adults being discussed, how often was aging being discussed, and looking at was that increasing over time as the plan went on. We also kind of tried to organize the activities of the city staff, but our partner nonprofit organizations into the domains to make sure we were addressing as many of them and as well as possible. And then that consultant team also interviewed key city staff and city council members. And then we also reviewed the city as a contract city. And so we have partners for all of our social services provision. So we looked at social services data and their reports to make sure older adults were still being served at high levels and what services they were accessing and what services they might need more of. And so that was how we did the initial community engagement, and it's how we continue to do ongoing evaluation of the plan. So I'm going to just drop this next slide. We also created social media handle that's called WeHo Cares. And that puts up a lot of information about social services, homeless services, but certainly also aging services. And then we have a specific page on the website that is weho.org/aging, where our strategic plan lives. Each year of evaluation is on that website as well. And so all of that information is now all in one place and easily accessible. There's also links to all the different services that are available through West Hollywood and through LA County that are all available there. But we wanted to make sure there was one place on the website that people could get to the strategic plan and see what all those domains are and what they mean and how we're trying to address those. So that's just the quick overview of what the city's Aging in Place kind of initiative looks like. And I'll turn this off now so we can just have conversation. So happy to answer any questions that you have.